Hi, I'm Dr. Lee. I'm a board-certified obstetrician and gynecologist. I went to medical school at Midwestern University, which is in Downers Grove, Illinois, and I continued my medical training in an OB-GYN residency at Mercy Hospital Medical Center, which is near the south side of Chicago. I recently moved to Milwaukee to start my job at Froedtert Medical College of Wisconsin. I see a wide range of patients. I've seen anywhere from adolescent in contraception counseling all the way up to the postmenopausal, where I would help treat menopausal symptoms, postmenopausal bleeding, any fibroids, things like that. So it kind of varies, and obviously majority of the patients will be within the reproductive age, just because of obviously the nature of what I do. But yeah, it's a huge range. It's a lot of fun, and it definitely keeps it interesting. And I get to interact with all kinds of different patient populations. So it's a unique part of OB-GYN for me. The age range of patients that I see generally go from adolescent to menopausal women. Anything from contraception counseling to prenatal care to general gynae concerns up to postmenopausal bleeding or menopausal symptoms. I'm particularly focused or interested in abnormal uterine bleeding or fibroid management, both medical and surgical treatments for uterine fibroids. I've done some extensive work in contraception counseling as well, so I'm very interested in working with adolescents in terms of sex education and just kind of teaching them about their bodies and things like that, and healthy sexual habits, and what their options are. Especially as a teenager, it's a little difficult. But yeah, majority of the times it's usually abnormal uterine bleeding and contraception counseling that I'm really focused on, but obviously it doesn't stop there. But my general philosophy with patients is that I have to establish a trust with them. I've heard many stories from friends and family on their horror stories with doctors that they felt like it was very impersonal. I went into the medical field knowing that I kind of have a different approach. I feel that a physician has to be empathetic and relatable. So that's very important to me. So usually when I see a patient for the first time, I try and just establish that rapport and let them understand that, listen, this is a partnership and not just me telling you what to do. And my main job is to help take care of the patient and let them know what their options are, educate them about whatever diagnosis they may have. And then from there, we kind of come together with the management plan where both of us has put our input in versus me just kind of telling them what to do. So yeah, my biggest thing is just to kind of establish that trust, that relationship, and that partnership, which I think is key. I think at Froedtert Medical College of Wisconsin, because it's an academic institution, I think it adds the benefit of having the most up-to-date standard of care. I think most of the times patients feel that, hey, it's an academic institution, there are people training, like medical students and residents and interns, but in reality it actually keeps everyone on their toes and more up to date. And studies have shown that academic institutions actually have better care just because of that fact alone. I think it also gives the patients every option that could possibly be out there, especially because usually academic institutions also have research involved. And so to kind of have everything available for the patient in terms of access to different specialties or just primary care or any other options that they may be looking for that may not be out there in other institutions. I think Froedtert Medical College of Wisconsin really does provide that for our patients. I think since I was 6, I always wanted to be a doctor, and I know that's a very cookie-cutter answer, but it's true. I definitely didn't always want to do OB-GYN, surprisingly, but I always wanted to do surgery. So I went to medical school to be a surgeon, and when I rotated in OB-GYN for the first time, I just fell in love. It's very unique. And you never get bored. It's always something interesting, and it's a combination of a lot of things like surgery, internal medicine, women health care, which again is unique in itself, and obviously you get to bring a baby to this world, which is always something very, very different from any other specialty. So I just found it very exciting, and it is nice to be able to be a part of certain stages in a woman's life, and these are major stages in a woman's life that an OB-GYN gets to be a part of, whether whether you're an adolescent and you're kind of growing into your body and your health and things like that, to prenatal care, to when you reach menopause. It's all these different stages that you get to be a part of, and you get to kind of grow old with your patients, which is something that I always wanted to do. Outside of the office, I like to go hiking. I like to travel. I also shoot pool, so whenever I can, or if I have some hours to spare, I do like to go to the pool hall once in a while, which is something that I think most people find a little surprising. I do read, and I do a little bit of art, but again, that's if I have some time off.